Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Ariel, an exercise oncology educator, and today's conversation is on walking to better health. Following our conversation, stick around for some gentle movement. The information in this video is for educational purposes only, and it's important to consult with your medical care team for more in-depth guidance and advice. Let's get started. Walking is one of the simplest yet most powerful forms of exercise, offering numerous benefits for everyone, but is especially important for cancer patients due to its unique impact on recovery, overall health, and quality of life. I am sure your doctors have said you should walk. It's great for your health. I'm going to cover why you should consider adding walking into your daily routine. First things first, it boosts your energy levels. Walking consistently can help fight cancer-related fatigue by improving circulation and oxygen flow. It supports treatment tolerance. The more you move, the better you're going to be able to tolerate your treatment, such as chemotherapy. Being physically active can improve focus and cognitive function, allowing for more mental clarity. Walking reduces stress and anxiety by releasing endorphins, which are the body's natural mood enhancers. And walking maintains muscle mass and bone health. It actually helps prevent muscle loss and keeps bones stronger, reducing the risk of osteoporosis. And research shows that regular physical activity can reduce the risk of cancer recurrence and improve survival rates, supporting long-term health. How to even begin a walking program? Well, first thing you want to do is always consult with your medical care team. If you're using assisted devices, be sure to take them with you. Your ultimate goal is to reach the recommended physical activity guidelines of 150 minutes of aerobic exercise. This sounds like a lot to start with, so let's go ahead and break it down. When starting any exercise program, you want to make sure that you set realistic goals for yourself to help with consistency and staying accountable. We will start with the duration or length of time spent walking. You want to start with a length of time where you will not tire yourself out too quickly. If walking for 20 minutes is too hard, start with 10 minutes of walking. If 10 minutes of walking is too hard, start with 5 minutes. Then increase your time by 2 minutes each week as you get stronger. Let's talk about exercise frequency. Exercise frequency refers to how often you engage in walking within a week. Once you reach your duration goal that you set for yourself in the previous slide, then you can gradually add more days of walking each week to get you to that 150 minutes of aerobic activity. Lastly, let's talk about walking intensity. You want to maintain a pace where you can comfortably talk and walk without breaks for the duration that you set for yourself. You are able to talk while you're walking. If you find that you are having difficulty getting your words out or catching your breath, slow down your pace. If you want to challenge yourself, try to walk faster or find a route with hills. When starting a walking program, you want to make sure that you have it planned out. So schedule it. Choose a time that fits your routine. If you're a morning person, then take your walk first thing in the morning, whether that be before you eat breakfast or after you eat breakfast. If you prefer evenings, then go for a walk after dinner, or maybe you get home from work, you go for your walk, and then you have dinner. Scheduling walks with a friend, a family member, or a support group is a great way to keep yourself accountable and make it much harder to skip that designated time for walking. And if you have a dog or young kids, use them as your motivation to get you moving. Lastly, let's talk about some safety tips. I want to ensure that you are as safe as possible when starting your walking routine. First thing, wear comfortable shoes. The last thing you want is to end up with blisters. No infections are wanted, or you don't want to put yourself at risk of falling. Staying hydrated. Drink water before and after your walk. If your walk is going to be longer than 2 or more miles, take some water with you or stop and grab some water on your way. Dress for the weather. Choose loose-fitting and breathable clothing and layer appropriately. Avoid extreme weather conditions. If it's too hot, too cold, or slippery outside, stay indoors. If conditions are unsafe, walk indoors. Take laps around and through your house. Go to the local mall, or maybe if you have a gym membership, go and jump on the treadmill. Thank you for being a part of our conversation today on walking to better health. I hope that the information I've covered today has brought you some clarity and comfort. Your health and well-being are what matters most, so please continue to take care of yourself, stay informed, and remember that hope is always present. Now let's transition into some gentle movement to further support your journey.
Hi, my name is Cynthia, your exercise oncology instructor with Maple Tree Cancer Alliance. Welcome to week 1 of our 8-week balance program specifically designed for cancer patients and survivors. The purpose of this 8-week program is to challenge and improve your balance. We will start slow and increase the difficulty throughout the program. We will also include full body strengthening exercises to improve overall stability and strengthen the muscles that help us balance. In week 1, we'll start simple with a self-assessment balance test along with stretching and a few fundamental exercises to get you started in improving your balance. For today, all you will need is a sturdy chair. The following exercises are meant to be pain-free. If you experience any pain from these movements, please skip and go back to what felt good or stay in a pain-free range of motion. So let's get started. Okay, so we will begin in a standing position. First, we're going to go through a simple balance test. This is going to go through a couple different movements, and we're going to hold these movements for about 10 seconds. If you've noticed yourself falling out of these movements that we're going to do, that's okay. Just take note of where you're at, and then just kind of pick back up or go to the next one. Just wait for me to catch up with you. So first, we're going to start with our feet together. So usually when we stand, we're about hip width. But here, we're going to bring our feet together and touching. It kind of just challenges the balance just a little bit, and then we're going to hold for 10 seconds. I will count. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pretty simple starting. The next one, we're going to have our left leg a little bit forward, and then our right toes are going to come into the little heel pocket that we have here for a staggering position. So we're also going to hold here for 10 seconds, and then we're going to move to doing the opposite foot. So we'll start with 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good, and let's switch. Again, if you need the chair near or by, just to kind of put a hand on, or a wall, whatever works best. So now our right foot is in front and our left toes are in that pocket of our balls of our feet right here, okay? So let's do 10 seconds holding here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. From here, we're going to do something called heel toe. So coming a little bit shorter than shoulder width apart. We're bringing our toes up and then rolling and bringing our heels up. So toes up, and we're going to do this for 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Take a little break, shake anything out if you need. From here, if you need to bring the chair over, do so. We're going to do single leg balance also for 10 seconds. So let's start grounding in with our right leg and just slightly elevating the left, holding for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Bend the legs, and then let's go to the other. Ground in with the left leg, kick out the right, holding, just hovering for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Release that. It's pretty normal for one leg to be a little bit stronger than the other. So from here, if it's accessible, we're going to take our shoes off. It's a little bit better to do this with bare feet. We're going to do some exercises with our toes. So finding a good spot about shoulder width apart. We're going to lift up our toes all the way and then curl them under so the bottoms of your feet are coming off of the ground. So we're going to do this 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. A lot of this is strengthening and helping with our foot stability. So focusing on the toes and the smaller parts of our feet help with our balance. So from here, we are going to lift up our toes, spread them as wide as you can, and then you're going to let your pinky toe on each side, on each foot, drop down, and you're going to slowly drop each toe down until you get to your big toe. So we're also going to do that 10 times as well. So again, lifting up, spreading the toes, and then dropping pinky down, following through the other toes, and then dropping the big toe. So on for 3, dropping down. Good. At your own pace, go ahead and finish to 10. Good. Let's do one more if you're on your last one. Good. Shake it out if you need. We're going to do something similar. So again, shoulder width apart. We're bringing up our toes, spreading them out, and then we are doing big toe down first and letting the other toes fall down and then our pinky. This one is a little bit harder. Some people are really good at the one we just did, letting the pinkies first and then the big toes. So at your own pace, bring the toes up and slowly drop the big toe and then next following toes all the way to the pinky. So we're doing 10. Good. Last one. That one's definitely harder for me. Let me get my socks back on. So from here, if you get a nice rest break going, we are going to go with standing calf raises. So we are going to do these 3 sets of 10, and each set we're going to have a little bit of a rest break in between. If you'd like, you bring over your chair. Just have it kind of next to you in case you feel like you need it. So from here, we're just going to start with standing calf raises. So you're going to come right onto your toes and back down. 3, 4, 6, 7, 8, 9, and 10. Take a little break. I can already feel it in my calves. Sometimes it can be helpful to find a focal point if you feel like you're having a difficult time keeping balance. Choosing something on the floor or on the wall can help. So for the second round, for our 10, bringing up for 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Take a little rest break. If you have water by, you can get water. Shake out the legs. Okay, for the last set, and up for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Shake it out. I can definitely feel it in my calves. Good. So have your chair and let's bring it in front so we can sit. Take a little bit of a rest break, but we're going to do another exercise seated here. This is going to test our trunk stability and our trunk balance. So when you feel ready, we're going to have both of our feet a little bit more than shoulder width apart. So just a bit more, and our toes are pointed a little bit out at an angle. So from here, we're going to take our arms. We're going to reach them in front. You can interlace your fingers, or you can point them just like this. Either way works. So from here, we're going to do something called seated reachers. We're also going to do these 3 sets of 10. So you're going to bring your back off of the back of the chair, and your arms are forward, and then we're going to reach forward, hinging at the hips, and come back. So your core, as we do this, thinking about engaging that, our core and our trunk muscles, our back muscles are all really responsible and helpful for our balance. So doing 10 of these, I'm at 6, 7, 8, 9, and 10. Good. Take a break, shake out the arms and the legs. Shoulder shrugs if you need. Good. Setting back up. Feet a little bit farther apart than shoulder width, bringing in our arms up and out. And for another 10, when you're ready. 1, 2, 3, 4, 5, 6, don't forget to breathe, 7, 8, 9, 10. Sometimes if you notice yourself holding your breath or struggling a little bit, audibly counting out loud helps your brain and your body just automatically breathe. So if you're counting 1, 2, 3 on each rep, it helps your brain think, oh, okay, I need to breathe. So take a little rest break, getting ready for the last set of these. Good. Setting back up, arms reaching forward and hinging at the hips for another 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good. Take a rest break, shake it out. Do some more shoulder shrugs. Loosen up any tension that we built up. Going back and then going forward. Good. From here, we're standing back up and using our chair to our side here. So from here, you can stand like this if you'd like. You can stand like this, whatever feels good. We're going to be doing something called hamstring curls, and it's pretty simple. We're just going to be holding onto the chair. We're going to be focusing on rooting in with our right foot. So feeling that stability and that balance. You can even do some of those toe stretches we did previous to kind of really get that foot grounded in. And now we're going to lift up and just bend with our left leg. I actually might move this way so you can kind of see the positioning. So keeping this foot flat, bending with the left leg, heel, you're thinking about your heel kind of going to your glutes. Doesn't have to touch, of course. That's just the direction it's going. So we're doing 3 sets of 10. 5, 6, 7, 8, 9, 10. And if you do these on your own, you can do your 3 sets on one leg, or you can do one leg and then do the opposite leg, whatever kind of feels good. So I think we will go with our right leg. So I'll do these facing forward for a different angle. So grounding in with the left, making sure that left foot feels nice and stable. And then bending at the knee, at the right knee, and lifting up. Good. Again, if you find a focal point to help with your balance and concentration, we're at 4, 5, 6, 7, 8, 9, 10. Good. Shake it out a bit. Take a little bit of a rest break. Okay, on to the other leg. Rooting in with the right foot and then lifting up with the left. For 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Let's go straight into the other leg. Rooting in with the left. Lifting with the right and bending at the knee. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Shake it out. We've got one more set on each leg. So getting ready for that. So going back in, rooting in with the right foot, lifting with the left and bending with the left knee for our last set on this side. For 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. Shaking the legs out if you need. Moving into the right side, grounding in with the left foot. Bending in the right knee for 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, and 10. Good. Shake that out a little bit. If you need to move around, let loose just a bit. So the next one we are going to be doing is called standing high knees. Again, it would be good to have your chair right next to you typically when you see people do high knees, you know, you're jumping up and down, but we're not doing that. We are isolating it. So we're not doing any jumping. So we're keeping our legs planted and just high kneeing on both. So we'll also do 3 sets of 10, but we'll probably do 1, 2, 3, like that. So you're going to want to root in with both feet, shoulder width apart. Have one hand on your chair. And then we'll start with the right leg, just lifting up, back down, lifting left, up and back down. So 2, 3, 5, 6, don't forget to breathe, 7, 8, 9, last one, and 10. Good. Take a little breather. Shake it out, and we're going to go right into our next one. So again, next set. Grounding in, lifting right leg. 1, 2, 3, 4, 5, 6, 7, 8, 9. Last one. Good. All right, one more set after this. Shake it out. Good. Grounding back in. This time, let's start with our left leg. Grounding in. Ready. Lifting left leg up for 1, 2, 3, 4, 5, 6, 7, 8, 9. Last one. 10. Good. Shake it out. Take a little rest break, and then we'll set up our chair for our cool down. Grab a drink of water if you need it. Shake it out and get ready for our stretching portion. So when you're ready, we are going to do something called a heel cord stretch, doing it on both legs. You can do these standing and in different varieties, but we're going to do this one sitting. So first, kind of coming to the edge of your seat a bit if you're able to, extending your right leg and lifting up the right toes, and then you're reaching down and you're pulling slightly on your toes, and you're feeling it really mainly in your calf, but it can go up to your hamstring as well. It's a good stretch, especially after the calf raises that we did earlier. Let's hold for 10, 8, 6, 4, 2, and release. Good. Shake it out and let's extend the left leg. Again, hinging at the hips, reaching with the left hand and pulling slightly so you feel that stretch back here. Holding for 10, 8, 6, 4, 2, and release. Good. From here, you can kind of scoot back again, and then getting a good base. We are going to do hamstring curls, but these are seated hamstring curls. So with our right leg, we're just going to bring it out and in. Doing 10 on each leg. Good. And when you're done with your 10, switch to the other side. Good. From here, we're going to be doing ankle pumps and circles. We'll be doing 10 of each. First, let's do ankle pumps with our right foot. We're going to be flexing and pointing our toes. These really help with circulation. And if you have any swelling in the body, especially in the legs, pumps that blood and circulates it. So let's do 10 on the right, and then switching legs, 10 on the left. Good. From here, we're going to be doing ankle circles. Let's bring both of our legs up at the same time. It's good if you have arm rest to hold on to, or you can hold on to the bottom of the seat. Bringing both legs up, and we're doing circles going to the left for 10 seconds. And circles to the right for 10 seconds. You can always do these one leg at a time too if this feels a little too difficult right now. You'll definitely hear some ankle popping. That's normal. And done. Release, shake that out. Good. So that will complete all of our balance poses and movements today. Thank you so much for letting me guide you, and I will see you next week.